Okay, go. Sorry.
Okay, so gallbladder 1.
I know.
So
Very
you
proud of
can
my
feel for
videos.
the infraorbital and supraorbital ridge, it's going to be just kind of on but behind slightly. That's gallbladder 1, use that for migraine headache. Then the next point that we have is going to be gallbladder 2. So gallbladder 2 is be directly below SI 19. So here's the tragus of the ear. And when we do SI 19, what you do is just move below and you'll feel a little notch that's called the intertragic notch. And points here. It's gallbladder 2, used for ear and jaw disorders. And then next,
What direction?
direction of pressure.
Yeah.
When we usually sedate, so we press straight in.
Okay.
Okay. When we work a lot of these points, you work them bilaterally instead of one side. But when we do the next set of points, we'll work one side. So next we have gallbladder 7, 6, 5, and 4, but 7's here, and they're going to be a line coming upward. If you go to the lateral edge of the eye and move upward inside the anterior hairline. Okay, then you'll have stomach 8. Okay, and then we'll have on level with the top of the ear and posterior to the margin of the sideburn. Then you have gallbladder 7, and then we'll have 6. Then you have 5 and 4. And there's clear depressions you can feel in each of these points. And so what I usually would do is recommend working them all at once and then do circular kneading. But make your circle small so you continue to stay on the point. If you make your kneading circles too big, when you're working an acupressure point, you'll just end up moving right off the point. So 7, 6, 5, and 4. And then next, and if your hand's ending up like this, you're too far forward. It's going to be more of a straight line. There'll be some, a little discrepancy from person to person as far as the line goes, just how the skull is formed. And then next we have gallbladder 14. So 14 is going to be one soon above the eyebrow in line with the pupil right here. And we use this point for like frontal headache, hangover headache, migraine headache. Those are the main indications for this particular acupressure point. And then I'll have you flip for the next couple of points. And we'll do. You can find gallbladder 20 when the client is supine, but I think it's easier to find, in the prone position when we initially find it.
So the point you just did, it's not right
Bladder
here at the
2.
corners. You just sort of move out just a little bit.
If the pupil is looking straight forward, it's above the pupil. Here you have bladder 2
Okay.
on the inside. Gallbladder 14's here.
So it lines up with the pupil if you're looking.
If you're looking straight ahead.
Okay, great.
So next we have gallbladder 20. So here's GV16 underneath the occipital protuberance. And so you can even grasp for the upper trap. You can feel it right there. So your landmark is the upper trap, and you just can move to the lateral side of it. And then when I work the point, if I'm sitting here, see, you move down and then lean your body weight back and angle in. The angle I'm trying to aim for the opposite eye with each side. Gallbladder 20 used for neck pain, headache, occipital headache, cold, flu, fever, eliminates wind. And this point is also indicated to help with glaucoma if you look at most of the acupressure books. So this is gallbladder 20. Okay. And then next we have gallbladder 21. So gallbladder 21, here's the trapezius. So we're looking at the high point of the trap. So you can grasp the trap. If someone's traps are a little thinner, it might be harder to, get on the point right away if someone has like big, thick traps. But your landmark can be the ear, so you just follow the ear downward. Okay, then grasp for the trap, and then you want to work right in the high point of the trapezius. So on some people, this point will feel like it's close to SI13 or SI14, just depending on how tight their shoulders are and how broad their shoulders are. So that's gallbladder 21 has the descending action. Use it for shoulder pain, shoulder tension, tightness. Okay, and then I'll have you flip so you're face up on the table for the next point, and then I'll be flipped over again. So next is going to be gallbladder 24. So the easy way to find the point is if you go to the sternal angle here, and then you just move lateral. Yes, this is, but a lot of people will, kind of, squirm around on this particular point. But it's here and here. But if you're not sure, we can count the ribs upward to find the correct space. But really, if you go to the sternal angle, move lateral, and then slightly inferior, that should take you to the acupressure point. But And then I'll switch to your left side next. So if we can count the ribs here, it might be a little hard if someone's very ticklish. So here's the 11th, and here's the 10th. So there's
How about if I do your kidney one and call me?
the
down?
9th intercostal, 8th intercostal, 7th intercostal space. Okay, so that's gallbladder 24. And then we'll have you face down again for the next couple points.
It's a zigzag.
So next we have gallbladder 25. Is it all right if I pull your shirt up slightly for this point? Okay. So you can show on the skin. So basically what we do here with this point is I'm going to move to the opposite side of the table just to show you how to run your hand. So the easiest way to find this point is if you just take the side of the body and you slide your hand upward like this towards the center, and then just move slightly superior. So here's the end. Yep, there's the end of her 12th rib right here. Slightly, yep, hers is pretty far out there. Which is there's nothing. I'm pretty sure. No, hold on. Let's see. Nope. Okay, so it fooled me. So that it's I have the same thing on my right side of my body, where my 12th rib actually points up towards my 11th. So like when on my side, on my right side, like you might miss it if you were trying to find it on me. So here's gallbladder 25.
Is this on the point location?
What's that?
Is this on the point location exam?
No.
Yeah, because if we had to do it on you.
No, I give you the list of 30,
Yeah.
30 points. This one's not in there. I don't ask anything super tricky. It's all stuff that's pretty obvious, I think. So this is gallbladder 25 here, okay? And then next, we'll move downward. I'm going to come over to this side now. So next we have gallbladder, okay, gallbladder 29. That's okay? So the easy way to find this point, okay, the easiest way is, so palpate for the greater trochanter of the femur. It's right here. It's pretty easy to palpate on people. And then you go to the anterior superior iliac crest, and Mandulus is right here. And so then you make just a line between the two, okay? And then when you work into the point, there'll be a pretty clear depression that you can feel. But here's how I recommend working into the point. If you just push straight in, you're going to be on the point, but a little bit off of it. The way you want to work the point is to scoop it. So you come down below and then angle. And here's this little tight. So like that. And then you can just lean your body weight in. So you kind of hook and scoop into the point. That's gallbladder 29. Use that for hip sciatic pain. And then next we have gallbladder 30. So 30, if you go to the hiatus of the sacrum, which is right here, palpate for the greater trochanter of the femur, make an imaginary line, and go a third of the distance in. Here's gallbladder 30. And gallbladder 30 is actually a bigger point. On most people, it has more of a depression when you work into it. And use this for sciatic pain. You know, this is a good point if you want to use rotating technique. You can press into the point and use rotating at the same time.
Why did you say we should be pretty familiar with this one? Was it in the full body routine?
Yep,
I
it was in
missed
the prone routine,
Yeah.
and you know, just it's a point that I think most people are familiar with gallbladder 30. I think. So, this is a good one for clinic when your clients come in with sciatic or hip pain. Okay, so that's gallbladder 30. Now our next point, we have a couple points left to find, is gallbladder 31. 31 is going to be in between the ITB and vastus lateralis. So I'm only going to measure 6 of my soon instead of 7. You know, so 7 of mine would be too much. I'll be up the point. So I'm just going to go 3, and then there's 6. Where the tip of my, where my pinky's falling, my 5th finger. And then I like to work this point. I usually squat if I work this point. But you could do it standing. So I can feel her vastus lateralis here, and then I can actually feel the ITB. And the idea is you kind of, again, with like gallbladder 29, I would suggest rolling under and back up into this acupressure point. And use this point for sciatic pain, pain in the channel in general. It eliminates wind from the channel. And generally, I'll use this point if people have a lot of, tightness, tension, doing specific work in the lateral side of the leg along the ITB. Okay, and then we'll have you face up again. So there's just a couple more points to go over. Next is gallbladder 34. So 34 is going to be anterior and inferior to the head of the fibula. So what you'll do is you just palpate. You know, if you see, okay, here's the easiest way to make sure you're on the head of the fibula. Is just go to the lateral side of the leg, start at the popliteal crease, and then just move downward. Okay, start lateral and just move down. There's a big, you know, nodule you'll be able to feel. There's two close together though, so if you're a little too anterior, that's going to be the lateral epicondyle of the tibia. So you want to make sure you're just on that line. And then the directions are just move anterior, in front of, and slightly below, and that's gallbladder 34. So this point it's an influential point of tendons in the body. Use it for sciatic pain. You know, I'll use it for tightness and tension in the lower leg, but it will help disperse chi through the body to help with muscle action. That's kind of the idea.
Is this the one you said people confuse with?
Yep. So here's gallbladder 34, and here's stomach 36.
Okay.
So they're pretty close together. They're like about a soon and a half, too soon apart.